The NYU Caregiver Intervention has a very large body of evidence to prove its effectiveness because we began to study it in 1987 and we were fortunate enough to have 20 years of funding from the National Institutes of Health in the United States. During that time, we were able to do a randomized controlled trial in which we enrolled 406 spouse or partner caregivers of people with dementia and followed them for as long as 18 years. So we were able to demonstrate not only short-term benefits, but long-term benefits as well. The NYU Caregiver Intervention is a multi-component intervention, and I think the package is much stronger than the sum of the parts. It includes individual counseling for the primary caregiver, family counseling for the family with the primary caregiver, a recommendation for participating in support groups that meet regularly, and ongoing support through telephone counseling on demand as needed. The intervention's immediate effect is to improve the caregiver's satisfaction with social support from family and friends. That in turn had a significant impact on caregiver depression, on the caregiver's reaction to the behavior of the person with dementia, on the caregiver's self-rated health, and because of the improvement in the well-being of the caregiver, we were able to demonstrate that people who got the NYU Caregiver Intervention were able to keep their relatives with dementia out of residential care for on average a year and a half longer than those who received usual care. The intervention was based on the clinical experience of people who were working at NYU when I got there. We think the stress process model explains the effectiveness of the intervention because it says that there are things that we cannot change, like the level of dementia of the person or the cultural background of the caregiver, but there are things that we can change. And the things that we can change are social support and the appraisal or understanding of the behavior of the person with dementia. And through changing those mediators of outcomes, we were able to have a significant impact on the well-being of both the family caregiver and the person with dementia. The original NYU Caregiver Intervention was conducted in the New York City metropolitan area. Since then, we did the 3-country study, which was conducted in Australia, the UK, and New York, and we demonstrated similar effects on caregiver depression to the original study. After we were able to demonstrate the effectiveness of the intervention in these 2 different studies, we received funding from the United States Administration on Aging to provide translations in many states in the United States. So we have given the intervention to more than 900 people in 7 states in the United States. There are new randomized control trials being conducted in the Hispanic population in Upper Manhattan, in Israel. Since we were able to demonstrate the success of this intervention, I felt it was really important to develop training so that other providers could do the intervention in the way that we were successful. And so we've developed online training that is now available so that counselors, social workers, nurses, and other healthcare practitioners can learn how to do the intervention the way we did and provide benefits much more widely. In addition, we've also developed an online version of the intervention that can be delivered by video teleconferencing, and we've recently begun a new randomized control trial of the intervention provided that way because we think that we can link families together with expert counselors who know how to do the intervention no matter where they live.